Dr. GarimaAsati. Welcome you all in my YouTube channel. Friends, today I am going to explain you about the topic rheumatoid arthritis in English on the demand of few of my non-Hindi patients. So let's talk about rheumatoid arthritis. It is a chronic inflammation of the joints. That's why it is arthritis but a chronic variety. And it is also an autoimmune disorder which affects mainly joints and other body organs too. The females most commonly affected between the age of 40 to 50 years, while male suffers it after the age of 60. And joint get warm, hot, swollen, painful, tender and stiff. So, this is about rheumatoid arthritis. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe my channel, tap the bell icon to get the latest update of the videos, and kindly see the video to the last as I am going to explain you some of the medicines which can be helpful in curing this rheumatoid arthritis. So let's continue with the sign and symptoms of rheumatoid arthritis. So the first and the prime important symptom is the involvement of the joints, that is gets stiff, red, swollen, hot and painful to touch, that is tenderness, as it is seen in all the arthritis, whether it is arthritis, gout, osteoarthritis or rheumatoid arthritis. So it is the primary and most important and most common symptom of this rheumatoid arthritis too. It also involves synovial membrane, and inflammation of the synovial membrane occurs and it causes synovitis, which can lead to the erosion or the destruction of the bones or the joints too. The common involved joints are small joints, that is interphalangeal joints, metacarpophalangeal joint, metatarsophalangeal joints, the joints of the shoulder, knee joints, ankle joints and hip joints, as well as large joints. Now, this stiffness is more in morning or after prolonged inactive period or phase, and it gets ameliorated from gentle movement, gentle exercises. So on waking, this stiffness is more, and after an hour working, it gets ameliorated slowly. So symmetrical affection is seen in this rheumatoid arthritis later on, that is both sides of the body gets affected with this. Erosion takes place in the bone, and along with that, fingers also gets deformed in this rheumatoid arthritis. So deformities can also be seen. So first talk about the ulnar deviation, that is the deformity, that is the bone of the forearm, that is ulna, it gets deviated, eroded and destructed, that is ulnar deviation. Next deformity is Brainia deformity, that is buttonhole deformity. So what happens in it? So the first, that is proximal interphalangeal joint bends inside towards the palm, and the distal interphalangeal joint, that is the farthest joint, it bends backside towards the back of the palm, and this representation is termed as buttonhole deformity. Next variety is swan neck deformity, which is just opposite of Brainia deformity. Here the proximal interphalangeal joint gets hyperextended and the distal interphalangeal joint bends towards the palm of the hand. So it is just like swan neck. That's why it is termed as swan neck deformity, which is just opposite of Brainia deformity. Next is Z-thumb appearance. In this there are three conditions present. First one is hyperextension of interphalangeal joints. Second is fixed flexion. And the last one is the metacarpophalangeal joint gets subluxated. That's why it gives rise to Z-thumb appearance. This is termed as Z-thumb deformity. Other deformities are hemato, and it is also known as arthritis mutilans because the joints gets mutilated in the severity of the disease of rheumatoid arthritis. This is all about the joint symptom and its deformities. Along with the symptoms of the bones, other body parts are also involved in 30% cases. For example, skin is involved, so there may be rheumatoid nodules present, which may be of few to centimeters. And it mainly occurs on the bony prominences like knuckles or elbow or heel joints. And vasculitis, that is inflammation of the blood vessels, may also be seen. And erythema nodosum, that is inflammation of the fat cells, can also be seen as a symptom of skin in rheumatoid arthritis positive patients. Diffuse alopecia areata may also seen. Lungs may get involved, so the nodules are present in the lungs and lung fibrosis may take place. Or pleural effusion may occur. RA positive patients have increased risk of heart diseases, that is heart attack, MI, stroke, atherosclerosis, LVF, pericarditis or endocarditis. Blood system may involve, that is it leads to anemia, low WBCs and increased platelet counts. Kidneys get affected and renal amyloidosis takes place, that is abnormal proteins get started produced in the body. That is the production of abnormal proteins occurs within the body. And if eyes get affected, then it causes keratoconjunctivitis, that is the inflammation of the conjunctiva along with the cornea, and it leads to dry eye syndrome. If liver gets affected, then it causes autoimmune hepatitis. In neurological symptoms, carpal tunnel syndrome may occur because of the swelling on the wrist. It causes compression of the medial nerve and lead to carpal tunnel syndrome. And in this, numbness at the fingers and thumbs may occur. It causes increased risk of cancer, periodontitis, that is inflammation of the tissues around the tooth loss, and some constitutional symptoms like fatigue, malaise, fever, loss of weight, loss of appetite too. These are all about the symptoms of rheumatoid arthritis. Now let's talk about its causes. So it may be genetic, that is having familial history. So they are having more risk of RA. Environmental factors like smoking, alcohol consumption or silica exposure, and it is autoimmune too. Now let's talk about the diagnosis of RA. So X-ray, MRI, CT scan, ultrasound and color Doppler can be done for diagnosis the destruction or erosion of the bones and the swelling around the bones too. That is the effusion, we can see through it. And in case of blood test, RA or RF factor can be detected, and ACPAs, that is anti-citrullinated protein antibodies. It is positive and it is always positive in RA cases. RA factor may be positive or may not be positive. It may show false negative readings too. Anti-CCP, that is anti-cyclic citrullinated protein test may also be done. ESR, CRP, that is C-reactive protein can also be done. Now let's talk about the classification criteria, which involves small joints and large joints, and we rank it as 0 to 10. So the small joints are interphalangeal joints, metacarpophalangeal joints and metatarsophalangeal joints. And the large joints are shoulder, elbow, hip joints and knee joints as well as ankle joints. So if there is involvement of one large joint, then the point is 0. If it involves two large joints, then the point is 1. If it involves 1 to 3 small joints with the involvement of or without the involvement of any larger joint, then the point is 2. If 4 to 10 small joints are involved with or without any large joint, then the point is 3. And when there are 10 joints are involved plus one small joint at least, then the point is 5. If the disease of less than of 6 weeks, then the disease is acute, having ESR and CRP positive. And if the disease is more than 6 months, then it becomes chronic rheumatoid arthritis. About management, so regular exercises should be done and in a moderate way. It should not be too much and it should not be a prolonged inactive phase. Now let's talk about the homeopathic cause, one of my cured homeopathic case, and some of the medicines which can be helpful in curing this RA. So the cause is autoimmunity, that is self-destruction, self-mutilation, and patient is regretting on himself, having reproaches on himself. Now, we talk about the case. A female patient age 53 visited my clinic having too much swollen ankle joint which was red, completely swollen, and the distal interphalangeal joint was also painful, too much, that is excruciating painful, having buttonhole deformity, tarsal joints as if sprained, icy cold numbness of the fingers, and along with that, when we take the whole case, we got she was slow in answers, memory was weak, dominating, dictatorial, restless, having suicidal disposition, very much impulsive, restless, and too much contradiction, intolerance was there. Delusion, fancies, indifference to everything. She was rebellious, positive, leader-like personality, homesickness, and she felt that she will fail in everything as she lost too much money in the business. She felt that everyone is her enemy now. Her partner has deceived her, and after that she felt very insulted because of it. The rubric taken were delusion, everyone is enemy, as she was suspicious to everyone, to each and every family members too, and delusion, everything will fail. So the medicine given was Merxol 200 and it gives result within a period of 8 months, and her buttonhole deformity also gets better. Now let's talk about the homeopathic medicines which can be helpful in curing this rheumatoid arthritis. So the first medicine is Restox. So the fingers are numb. There is a sensation as if shoulders would fly into pieces. And the interphalangeal joints are hot, swollen, and buttonhole deformity may be seen in this medicine. There is a paralyzed sensation in the arms too. Now about the mental symptoms. So there are suicidal thoughts and patient wants to drown himself. Along with it, there is a delirium being poisoned. There is a constant restlessness and patient wants to change the position. There is a physical restlessness along with it. There is causeless weeping. So if these symptoms are there in the patient, it can be helpful in curing this rheumatoid arthritis. The next medicine is Brainia. So in this, elbow joints are swollen, painful and tender. Fingertips and finger joints all are swollen, hot, painful and tender. And patient is unable to write anything, to hold anything. So even the grip, that is gripping the pen, becomes more difficult for the patient. Fine grip movements are more difficult. Along with this, the mental nature of the Brainia may be having fear of poverty, always talks of business, and they are firmly rooted in the material world, always thinking of the material things only. And there is a delusion that he wants to go home. There is a homesickness is seen in Brainia patient. So if these symptoms correspond, then it can be helpful in curing this rheumatoid arthritis. That's all for today. We'll meet soon with a new subject, new topic. It's my humble request to you all, kindly don't take any medicine without consulting the doctor. The clinic address of mine and contact number is given in the description link. Stay connected to stay healthy. Thanks for watching.